In this video, we're talking about PAILs and rails. Now, these are concepts from the Functional Range Systems framework. Really, they're the bulk of the work that we're going to be doing in Kinstretch. They stand for progressive and regressive angular isometric loading. A lot of words, you don't actually have to remember that, but just know that they're loading strategies that we're going to use to load the tissues in our body for a few different goals. Those goals are trying to increase range of motion, we're trying to increase neurological control, and we're trying to increase end range strength. So I've talked in another video about the difference between flexibility and mobility. Flexibility is passive, meaning that I can passively raise my knee pretty high towards my chest, but actively I can only make it so far, right? So there's a gap between those two. What we do in Kinstretch, we use these concepts to try and open up more space, more range of motion, more passive range of motion, and then we can build some end range strength. We're trying to build or bridge the gap between the active and the passive range of motion that you have. So this is one way that we're going to start that. But really, the big goal that we're constantly thinking about is increasing our range of motion. Then we have other drills that we're going to follow these up with to build that control up as well. So I'll go through some examples and then we're going to talk about irradiation again, because really that's one of the most important concepts as we're going through these PAILs and rails. So now you know what PAILs and rails actually stands for. Let's get into an example. So I'm going to drop down onto my butt here into the number 4 position for like a traditional hamstring stretch if I was reaching forward. Really what I'm going to do to set it up is I'm going to sit nice and tall. I'm going to think about rolling my pelvis forward. My knee is just going to be slightly bent, and I can give myself a little extra leverage, but I'm coming forward until I feel that stretch on the back side of my leg into that hamstring tissue. So PAILs and rails, different loading strategies. Loading, we're also going to talk about irradiation, and that's how we're going to load it. Now, for our PAILs and rails, if we're looking to improve range of motion or joint workspace and strength, we have to have high intensities. So when we go through our PAILs, that's always going to be the first part, and then the rails are going to follow. I'll cue you to start gradually building up tension or that isometric contraction. In this position, that means that the progressive side for the PAILs is the stretching side, the hamstring tissue coming down the backside of my leg. The further I lean forward, the more the backside opens up or that hamstring starts to lengthen progressively. The regressive side is going to be the hip flexor tissue. The further I come forward, the shorter that tissue starts to get. Now, when we jump into it, again, I'll cue you to start bringing that intensity up. Remember, our goal is trying to hit a maximal, safe, or comfortable contraction when we're going through our classes. Now, we use PAILs and rails for other purposes too. I use them as a clinician to help guide through people through the injury process, and that's where we can adjust that intensity. Also, if you're experiencing a cramp, which typically happens when you're doing your rails, you may have to back off that intensity a little bit until your body gets used to it and that cramp goes away the more you start to practice and strengthen and get your body used to working in that shortened position. So going back to our example here, if I'm all the way forward into my end range, what I want to do when I initiate my PAILs is pull my heel down into the mat. So I'm trying to extend my leg down through the floor, which is going to engage that stretching tissue back there. So that's the PAILs contraction. The rails is going to be the opposite. I'm going to engage the hip flexor tissue to try and lift my leg from the floor. So what it'll look like in our classes is I'll have you find the stretch. So everyone's going to be a little different. Each position is going to be vastly different. I'll help you find the stretch where you need to be. We're going to include a passive component where you're stretching, you're focusing on your breathing to help open up more flexibility. Remember, passive flexibility. And then we'll get into the PAILs and rails. So when I say start, we'll take a deep breath in, pack the core, you'll irradiate through the whole body, max effort here, and then 20% to start into the working component, or right now into my leg. 20% effort, pulling my heel down into the floor. Gradually we're going to build that up. So 20 to 40, 60, 80, and as hard as you can, driving, for me, my heel down into the floor right now. We're gonna hold that for a certain amount of time through the PAILs, and then immediately after that, when you go through your rails, you're just gonna go immediately 100% effort. So here, I'd be trying to lift that leg up off of the floor, pulling myself further into this hip flexion position. So we go slow into the PAILs, and that's because that tissue is already on full length. We want to gradually build that tension up. And then we'll go 100% right away into our rails. It's in a shortened position. It's more comfortable just to jump into it, but it is very difficult and it should be challenging. Remember, to get the desired effect, we have to put that intensity in. So when you're irradiating and you're working on these positions and movements in class, you have to build that tension up. If you're dealing with something like an injury or pain, of course, we're just working up to the level of tolerance, and hopefully you're recovering or you're working with a professional at the same time to get over that injury so you can safely and effectively participate in this type of training. Quick review. So in this position, PAILs will be pushing down. That lengthening side is going to be contracting. Rails is trying to lift up. That shortening side, or the short side of the joint, the closing angle of the joint is going to be contracting there. We'll hold those for a certain periods of time, and we'll typically do a few sets of those with passive stretching and some recovery time in between so that you can find that new stretch, open up some new range of motion, and then we facilitate more range of motion and strengthening so that you can maintain it and carry it session to session or day to day. Now, the last thing I want you to remember as we're in this position, if I'm at my end range, if this is as far as I can go here, I'll do my PAILs contraction. If I start my rails and I can actually lift my leg up, that means that I'm not at my end range, right? So if I'm all the way into my end range, I don't have any more passive motion to go, there's no way I'm gonna be able to actively lift further into it. So just remember that in every position that we're working on, we can change it up here too, into the 90-90. If I'm fully at my end range and I'm stretching here, I can't externally rotate my foot any further. If I was out of my position, now I can externally rotate and lift up. So that's where the isometric part comes in, is that you're at end range, you're working the progressive tissue, the regressive tissue. There's not actually any motion that's happening, which is always the odd part when you start, but you're putting in maximal intensity or building up to that so that we can get the desired effects of building more range of motion, more control, and more strength throughout that entire range of motion, which is mobility training. All right, I know it can be kind of confusing as we get started with the classes. If you have any questions, always let me know and we can walk through it again. We use these concepts in every class, in every position you can think of, all with the idea of adding tension or load to different lines of tissue throughout the body. All right, I'll see you in the next video.